Hi, I'm Matthew Weinstock, Senior Editor of Hospitals and Health Networks. And I'm joined today by Premier CEO and President Susan DeVore to talk about some of the transformation we're seeing in the healthcare field and to talk about Premier's effort to improve quality and reduce cost. Susan, thanks for joining us today.
Thank you.
So healthcare is going through quite a transformation right now. We're seeing quite a bit of emphasis on accountable care, emphasis on hospitals being more accountable for the quality of care they provide. You've had some experience with the Quest project at Premier at the Health Alliance. Can you tell us a little bit about that project and the results you've seen?
Well, Quest is really an effort to define what a high-performing hospital or health system is. So it's really pretty simple. They measure themselves on 5 dimensions. There's a dimension on cost, a dimension on mortality, a dimension on harm, a dimension on evidence-based care, and a dimension on patient satisfaction. And the theory is, if you can prove with data and with your practices that you are high-performing in all 5 of those things at the same time, then might you call yourself a high-performing healthcare system. So that's the work that they've been doing. We're about 2.5 years into it now. They're seeing dramatic improvement in a lot of the dimensions. So
let's talk a little bit about the results you've seen about those hospitals, those 200 hospitals or so, save about $23 billion, save about 22,000 lives, right?
That's right.
Mortality rates have declined. What are those hospitals doing that is so different from the rest of the field?
A lot of things they're doing. First is they're measuring in a standard way. So they defined those measures in a standard way. Second, they're submitting data and they're managing this on a more real-time and current basis. They're trying to take out some of the lags of information. Third, and probably most important, they are focusing on areas that will move their overall performance. So for mortality, for example, a real focus on sepsis, a real focus on palliative care.
What challenges do you see then moving forward? Quest 2.0 is in the works, so where do you see that moving and what big challenges do you face?
Well, Quest 2.0 is going to bring in some readmission measures, possibly some additional harm measures, going to bring in some outpatient evidence-based care measures. And so I think we'll have the same challenges that we have with those with some of the earlier on measures, which is, figuring out what your starting point is and then figuring out how you drive changes that really impact the performance and keep moving it up. I think they'll have those challenges. I think those challenges they have now are in the context of this big reform legislation. And a lot of our hospitals are living in these two worlds, the one which is all the cuts that are here and coming, and the other which is let's reinvent a care delivery system for the future. And they want to do both, but it's pretty overwhelming work.
In February, Medtronic reportedly canceled some contracts with GPOs, including Premier. What impact is that going to have on the field?
It's an interesting situation in the supply chain world. So what I would say is, we're aware that Medtronic seems to have canceled a contract with Novation. They canceled a spine contract with Premier. We're currently still in discussions with them about our CRM contract, which continues. But it clearly looks like a business decision they've made for the benefit of their company and their stockholders. And our hospitals are asking the question, why and how is this conducive to the work we're all trying to do to lower the cost of health care and to improve the quality?
Right. And lastly, I'm just curious, kind of open-ended here, are there other things in the supply chain that you feel like hospitals executives perhaps aren't attuned to that may be driving some cost into their system that they could potentially get out of their system?
Well, I think there's a real issue of drug shortages, and I think maybe a lot of hospitals aren't completely aware of that. I have a lot of concern about our dependence on foreign manufacturing and what could happen to the supplies. Some of our real commodities like masks and gloves and aspirin if we had any kind of a pandemic or other things. So I'm not sure people are completely aware of the dependence on foreign manufacturing, the drug shortage problems, the lack of ability to clinically compare the real differences in products. And so I think there's a lot of work in supply chain to be done as well.
Great. Well, thanks for being with us today.
Thank you.